Hello, my name is Lisa McPhee. Thank you for joining me during this presentation. I will be introducing the Lumbar Spine MRI Companion Form project. This is a project that I've been working with Shared Health Services and Choosing Wisely Manitoba. I'm a radiologist working in Manitoba, and the following members were part of our project team. I'd like to thank them for all their hard work. This project has also been approved as a targeted practice improvement project from Clinical and Preventive Services Plan. The Choosing Wisely movement is a movement which has doctors and patients having conversations about unnecessary tests and treatments and making smart and effective care choices. The movement was started to help reduce some of the inappropriate ordering across Canada and make our healthcare system more sustainable. It has been shown that up to 30% of healthcare in Canada is unnecessary, and MRI lumbar spines are certainly in and amongst this 30%. One Alberta study found that about 28.5% of lumbar spine MRIs were inappropriate, and another 27% were of uncertain value. In Manitoba, one of our diagnostic imaging residents did a qualitative review of all the requisitions sent in from Health Science Centre and St. Boniface over 1 week. Approximately 28% of these lumbar spine requisitions were deemed to be inappropriate based on the information provided as compared to current evidence. Recommendations related to back imaging are from a variety of different societies, and these include Canadian Association of Radiology, Physical Medicine and Rehabilitation, Canadian Spine Society, and Occupational Medicine. There are other members too that have put forth guidelines with respect to not performing imaging for low back pain. And here are the Canadian Association of Radiologists guidelines, which are on their website and on the Choosing Wisely website. And it states that to not do imaging for low back pain unless red flags are present. And red flags are things such as suspected epidural abscess, suspected cancer, suspected infection, severe or progressive neurologic deficits, and suspected compression fracture. In terms of patients with uncomplicated herniated disc or spinal stenosis, it's recommended that imaging is only indicated after at least a 6-week trial of conservative management. Some of the benefits of using the Choosing Wisely guidelines will that there will be a reduction in low-value tests. And with this reduction in low-value tests, this means that there will be an increased capacity for examinations that are required for diagnosis. This would also in turn reduce wait times for other imaging, which is of higher diagnostic yield. And additionally, many examinations performed for musculoskeletal imaging, such as MRI of the knees for arthritis, in most patients do not change treatment or change outcomes. An initial project was performed in Boundary Trails, which was our pilot project, implementing the low back imaging companion form. The Boundary Trails implemented this companion form at 2 large clinics. A radiologist in Boundary Trails, Dr. Blair Henderson, provided education at the site medical education day sessions and introduced the companion form to the physicians working at these referral sites. 6 months following implementation of the screening form, the physicians at these locations were ordering 56% fewer lumbar spine examinations than 6 months previously. This is a chart which just demonstrates the reduction in ordering over that 6-month period. In Manitoba, there are approximately 10,000 MRI lumbar spine examinations performed. The wait time listed here of 36 weeks was the wait time prior to COVID. Each lumbar spine examination is typically a 30-minute appointment block. Currently, lumbar spine examinations make up approximately 12% of total MRI volumes in the province, and our current wait time is 36 weeks prior to COVID. Since COVID, the wait times are quite a bit longer than this and have significantly delayed other examinations, which although many of them are deemed elective, some of them are crucial to diagnosis and staging of disease. Based on the results of the Southern Trial Project, it's estimated that there's a potential 30% reduction in lumbar MRI examination performed with a screening form, which equates to approximately 3.6 reduction in total MRI. This 3.6 reduction would result in 2,720 fewer examinations per year, creating an additional 226 appointment slots. This is expected to reduce the wait times by a week or more. I should mention that this initiative is a province-wide and will be implemented across the entire region of Manitoba. Some indications of spine MRI are listed here. These are from the Canadian Association of Radiology website, and this is in their standards or referral guidelines. The referral guidelines not only have a section on MRI of the lumbar spine, but are organized into different body parts and groups, and there are indications in there for a CT of the brain, chest, abdomen, and they're a great resource if you're looking for something to assist you with ordering. Here's just another slide on the current indications for a spine MRI examination. This is the companion form that we are going to be placing in the EMR vendors. Alberta, Ontario, BC, and Saskatchewan all have similar type of forms that are required as part of a person ordering MRI of not only lumbar spines, but often of the knees. And so I'll be going through this form just to demonstrate what information is required. On the form in the top right corner, there's information for the patient's name and demographics. There's also a box which discusses the patient's date and that they're seen and their age and the referring physician. And here's a statement that says the purpose of an MRI for low back pain is to look for suspected disc herniation, nerve compression, or to rule out metastatic disease. The most common cause of low back pain is mechanical and will resolve itself within 12 weeks. This information can be shared with your patient. Here's the next box following that, talks about whether the pain is back dominant or leg dominant pain, and if there's other issues that you're concerned about or the patient's concerned about, these can be filled in this box. And here is the eligibility information with the check boxes stating and asking whether the patient has a red flag symptoms or whether MRI was recommended from a previous report, if the patient has had a previous back surgery, or whether there is pending or anticipated back surgery. And the last statement states that if there are no items checked yes, lower back MRI or CT is not indicated and not recommended and not likely to identify the cause of pain. So the form that you've just viewed will be built into the EMRs as a 2-page form. The first form that will come up will be the companion form or the MRI requisition form. Each form will come up together and both will be required when an examination is being ordered. When the screening form is completed with the patient, you can show them the information and it will help them know that sometimes they will not be receiving an MRI examination or that that's not the recommended care. The patient can be provided with tearaway pads that I'll be showing you that talk about low back pain and some of the other information. If MRI is indicated, both the screening form and MRI requisition form will be sent to central intake. It is important to note here the MRI requisition form is still noted. We will also be providing tearaway pads which can be provided to the patient, which talk about back pain and when imaging is required and what is not required, and these will be uploaded onto the EMR system as well and are also on our Choosing Wisely Manitoba website. The next step in the process is once the forms are filled in and sent to central intake, there will be a graduated process in allowing physicians and patients to adapt and learn. So initially, if there is a missing or incomplete form, then you'll be contacted by central intake to fill out the form and resend. As this process escalates, then we will expect that both the screening form and requisition form are filled out each time. The forms will be built into the EMRs, and the project team has engaged with Digital Health, who will be getting this information into your EMR vendors. There will be some education strategies planned in the upcoming year about having back pain as a general topic in primary care and how to improve patient education and discuss appropriate and inappropriate imaging. Implementation will begin in November, and you'll be receiving further memos on this project. I'd like to thank you for listening to this presentation. If you have any questions, you can contact me at the following email address. Thank you.